Hello everyone, welcome to the annual general meeting or AGM of Eastern North Herts Teaching NHS Trust. My name's Anita Day and I'm Chair of the Trust. I'm delighted to welcome those of you who are joining us online and indeed those of us that are here with us today in person. Our AGM, as you probably know, gives us an opportunity to tell you all about what's been going on in the Trust over the past year and to look forward to the year ahead. This is my second AGM as Chair, and I'm really pleased to share some of the fantastic progress that we've made over the last year, including patients being seen sooner for urgent and emergency care and for planned procedures, improvements in maternity care, and improved staff experience. These are just a few examples of the things that we're going to be touching on this evening, and which have led us, and we're really proud of this, to being finalists in the Health Service Journal Trust of the Year Awards. Next slide, please. So this evening, what we're going to be looking at is this. I'm going to start off a little bit and just talk about the last financial year, our achievements of the Trust, talk about our charity and our volunteers. Then I'll hand over to our Chief Nurse, Teresa Murphy, and our Medical Director, Dr. Justin Daniels, who will talk about the quality of care that we provide. Then Martin Armstrong, our Chief Finance Officer and Deputy Chief Executive, will present our annual accounts. And then, last but not least, we'll hear from our Chief Executive, Adam Sewell-Jones, who will talk about our future direction and priorities. Please remember that you can ask questions at any time during the meeting. Please just use the YouTube chat, and you don't have to wait to the end. Just do it whenever a question pops into your head. But before we get going, perhaps it would be helpful for me to set some context to the information that you're going to hear about this evening. Next slide, please. Our Trust serves a community of around 600,000 people in our local area and around 3 million for our specialist cancer services at Mount Vernon. And as you can see from the numbers on this slide, nearly half of our community has used our services in some way or another in the last year. You'll also see how demand for our services has increased. Around 12,000 more people attending for urgent and emergency care in the last year. We've made great progress on our waiting lists, but we also know that some people are still waiting too long for diagnostic tests and for treatment. And we're working really hard to do what we can to reduce those waiting lists. Next slide, please. A bit of interesting and hot off the press news. Last week, the NHS announced its new Oversight framework. And if you haven't had a chance to look at it, I really would recommend it because it's an interactive dashboard that the public can use to see how their trust is performing. I'm delighted to say that our trust was the top performing acute trust in the whole of the east of England and 19th out of 134 acute and specialist trusts in the country. We're graded as being in segment 2, which means that we're performing above average. Next slide, please. Teresa and Justin will talk in a few moments about how we're improving care, but I did want to highlight some recent improvements in our waiting times. People seeking urgent care are generally seen within 4 hours, generally 78% of the time. That places us 38th out of 124 trusts. Our waiting times for cancer treatment remain amongst the shortest in the country. And only 1.4% of people are now waiting over a year for treatment. Now, that's still far too many, but it is an improvement, and we're working really hard to get that down. Of course, there are some areas where we have definitely got more work to do. One of them is our community paediatric services, including for those children waiting for diagnosis of neurodiverse conditions. This is caused partly because demand for this service has increased hugely in recent years. We are working together with partners across the NHS to find a way to see children as quickly as we can. We're also continuing improvements in our audiology service, as we know that both adults and children are still waiting far too long. And in 2023, we launched something that we call our Patient Hub, which helps patients to manage their own appointments and letters online. Over the last year, we've really expanded this service, and it's now being used in 36 specialities and over doubled in terms of usage. Next slide, please. And this logo shows something that we are particularly proud of in the last year. We are continuing to invest in improvements in education, but our recognition as a teaching trust is really important to us. It reflects the hard work that happens day in, day out across all our sites to ensure that all our students and trainees receive high quality education. Part of this recognition means that we're going to be working even more closely with our partners at the University of Hertfordshire to prepare for the opening of the new Hertfordshire Medical School in 2026, which will in the first year open its doors to 70 international students. Next slide, please. And whilst that's about patients, let's think about what's been happening with staff. We've seen some really great progress in terms of our engagement and staff content with working with us. In our staff survey, we had improvements in all 7 People Promise themes and were rated the 4th most improved trust in the country. We've also seen improvements in the Workforce Race Equality Standard and the Workforce Disability Equality Standard. That's not to say that there isn't more to do. We want to ensure full equity for all our staff, but these are really significant improvements that we're very proud of. And we're continuing to work on this great foundation to become an even fairer and more equitable employer in the years to come. Next slide, please. And in January, we introduced our new super improved Values into Practice, or VIP awards. Lots of photographs of happy people and our chief exec, Adam Sewell-Jones. These awards recognise and celebrate staff who demonstrate our core values of include, respect and improve, with prizes kindly donated by the Trust charity. This is one of Adam's and my favourite jobs. We get together looking at all the citations, the stories behind each one, and it's lovely getting the chance to read them all and help to choose the winners. Next slide, please. We're also continuing to improve our built environment and equipment for our patients. Amongst other things, we've opened our innovative vascular hybrid theatre, a centre of excellence for the whole system. We have a new family room in the Children's Assessment Unit, funded by the Integrated Care Board. New state-of-the-art linear accelerators, which are for radiotherapy at Mount Vernon Cancer Centre. We're also investing in sustainability, new LED lighting and solar panels. And of course, we have to carry on with our backlog maintenance, ensuring that our buildings live up to the standards of fire safety and improved ventilation. Next slide, please. A lot of what we do could not be done, however, without our hospitals charity, and to our communities who so generously support the charity. We are incredibly grateful for their support, and we know that, as I say, both our patients and our staff benefit hugely from their involvement. Next slide, please. Some of the things the charity has done in the last year, they have raised £1.5 million, more than last year, and an incredible amount of money. This allows us to do even more in terms of the extra touches, the little things that help make life easier for our patients and staff. Next slide, please. A couple of examples of things that the money's been used for. The Forget-Me-Not Dementia Volunteer Service helps patients with dementia feel more at ease when they're in an unfamiliar hospital setting. The charity started off funding the coordinator role, and the Trust is now funding this on an ongoing basis, a really valuable service that we get such great feedback on. There's a wound care simulator for dark skin, which is helped by the tissue viability team to help help staff recognise pressure ulcers and wound care in patients with darker skin tones as well as those with lighter skins. And then also for cancer patients, we've got 14 new reclining chairs as modelled there in the middle, which are much more comfortable for our patients, and also some grants for other things. Next slide, please. The charity also funds many initiatives for our staff, including our annual Thank You Week, our annual Staff Awards, and indeed, as I mentioned a few minutes ago, our VIP Awards. We can't say thank you enough. On behalf of all our patients and all our staff, it's really a vital role. And to anyone that's watching, if you haven't got involved with a charity, please think about doing so. There are lots and lots of ways of getting involved. You don't have to do abseiling, but there are runs and fire walks and all sorts of things. It's a lot of fun, there's a real camaraderie about it, and you know that you're really supporting a good cause. So I know lots of our staff already get involved, but yes, always love to have more people participate. Next slide. And finally, I'd like to thank our volunteers. They are an incredible bunch of people, and as I walk around the hospital, I come across them every day, day in, day out, looking after our visitors, looking after our patients, helping them find the right place, helping them, signposting them to the things that they need. That we are so grateful for everything that we do, that they do for us. It's not we could not possibly do that without them. So again, really, really grateful. And those, of course, those volunteers are both humans, but also animals. Some of you will know we have Shetland ponies. We also have some wonderful dogs, and in fact, recently our therapy dog team won a staff award over in the summer. It was lovely to have them all come up on stage, and it was the highlight of the evening for many people. To everyone, to our staff, to our volunteers, to our partners, and above all our patients, thank you so much for working in partnership with us. Doing what we do is a team sport, and we are incredibly grateful for the part that all of you play in helping us to deliver the best possible care we can. Thank you. Now, I'd like to hand over to Teresa and Justin to talk about the quality of care.
Thank you, Chair. Good afternoon. My name is Teresa Murphy, and I am the Chief Nurse at the hospital. So I'd like to move on to my next slide, if I may. I'd like to talk about some of the transformation that's happening across our hospitals, starting with our implementation of patient responsive incident safety service, PSIR for short. This is a way of wrapping all of the safety standards around the patient, making sure that we provide compassionate and engaging opportunities to make sure that patient safety is at the forefront of everything we do. I'm really proud of the fact that we've managed to engage patient safety champions to support this work, and that even this afternoon, I believe our team is in Manchester being supported as one of the runners-up for the Patient Safety Team of the Year award. The improvements that we can make through implementing this system is around making sure that everyone's voice is heard, the patient, the carer, and the family, and also the clinicians. So please do, if you want to support us, become a patient safety champion, just let myself know via the comms team. If I can move on to the next slide, please, Chris. So what's going well? Patient safety screens at a glance. In all of our clinical areas, what you'll see is the screens that we have that have the key patient safety indicators that you would expect to see in a clinical environment. This allows our staff, any time of the day or night, 7 days a week, to be able to identify patient safety risks and also make sure that those are mitigated. Wards and departments and our ward leaders are actively supporting and pushing patient safety at every opportunity. Overcoming cultural barriers, working together as a team, making sure that we are collaborative in every aspect of patient safety and experience. This has been a real opportunity for us to showcase the best of what we can do in terms of patient safety. Next slide, please. Here you'll see some of our metrics that we've identified. It's good to report instances, and we encourage all of our staff to do that. So our first slide you'll see there is the total number of instances that have been reported. And if you look at the good care instances, that's the chart below. This is where staff have realised or recognised a really positive experience that a patient has had, and they've recorded it. If we go to the charts on the right, you'll see our falls per 1,000 bed days, and you'll see that we are in some of the best performing in the country. Recognition for our reduction in falls, both locally, regionally and nationally, has been acknowledged by safety teams up and down the country. And if I go to the last slide, you'll see our sequential reduction in serious harms to patients and how that is gradually improving every year. And with the implementation of PSURF, I believe that this will be more impressive as we move towards zero harm. Next slide, please. Patient satisfaction and patient experience is vital, and it really is what the patient tells us. So if we look at the national surveys, there's the maternity survey, the children and people survey, the national inpatient survey, and also the emergency care survey. As a trust, we're really focusing on trying to get the patient's voice in everything that we do, but also in the boardroom, and to make sure that our patients are truly listened to. You'll see some of the quotes there from people who have had touched different parts of our services, and I'm really pleased to see a quote there from our patient safety partner, one of them who sits on our committees but also is a partner and a patient in our service. Next slide, please. Some of the improvements that we're working on collectively as a clinical group is to make sure that our patients and our communities that are hard to reach or also experiencing health inequalities have the opportunity to work with us in a meaningful way. So currently we're doing some really seminal work with the profoundly deaf community, and I know that health colleagues in Health Watch are doing something similar. And we're also working with our learning disability community. We have just recently appointed our first learning disability nurse. Putting our carers' voice in every aspect of everything we do has been really has transcended how we treat patient experience, and I'll talk later about the number of carers that we have in our community. Next slide, please. Dementia is a condition that affects approximately about 1 million people in the UK, and it's something that could touch everyone's lives. So it's really important that we, as a collective group of trusts, work together to make sure that dementia care is the best it can possibly be. So we have invested in our dementia care services. You will see that our dementia team have won an award locally and regionally, and indeed again we're up for the National Nursing Times Award for Best Practice. We've invested in dementia environments, and we've also tried to make sure that there's really patient-centred care all around our dementia patients. Improving meal times is very important. We know that our dementia patients don't always want to eat with a knife and fork. They may want finger food. And so we've really worked on what works for them, what works for that individual patient and that family and that care. Very proud of the work that we're leading on, and there's always more to do. Next slide. So earlier on I touched on carers. I'm really proud of the work that we're doing with carers. We now have a full-time carers lead in the trust, and she's extremely busy. So expanding our volunteers, working with local colleges and working with local schools, and encouraging really the younger generation to be part of this journey, improving carers' experience. Sharing the needs of the carers and making sure that they have access to all the information, where to get car parking, how to access food out of hours, and making sure that their voice is collectively heard through the forum that we have every quarter. Next slide, please, Chris. Our Enhanced Nursing Care team is a really unique team, and they're a group of nurses and occupational therapists and care support workers who work together to keep our patients safe in and out of hours. They special confused patients, they look after vulnerable patients, and they really are an emergency service to those who are in clinical practice. Their work's been acknowledged locally, regionally and nationally, and a lot of the work that's been led on nationally around enhanced care teams, you will see, has come from Leicester Hospital. So I'm really proud of the work that they've done, and I have no doubt the reduction in patient falls is attributable to their standards. Next slide, please, Chris. And finally, but not last, our chair talked earlier about the work that's being led in maternity. Our maternity unit has been on a really significant improvement journey, and we have an excellent maternity triage system. Not only is it best in class, the training, the education, the opportunity for our midwives to learn how to safely triage a woman and work as part of a multidisciplinary team. We've enhanced our digital access for partners and for women, and our training programme, which is an e-learning programme, is soon to go across the country and perhaps even wider. There's always more to do in maternity, but this is a really excellent place to start. Thank you.
Hi, good afternoon. My name is Justin Daniels. I'm the Medical Director of the Trust. Chris, can I have the next slide, please? So I'm going to talk a little bit about mortality rates and some of the other numbers that we look at regularly as an organisation to make sure that we're providing safe care. Every death is a tragedy for the family involved, but it's really important that we as an organisation look at those deaths and make sure that what we're doing is the very best that we can. So what you'll see on the two upper graphs is two of the different ways that we monitor mortality within the organisation. The yellow line at the top is the national rate of deaths, and the rate we would expect as an organisation. The blue rate is the rate that actually happens within our organisation. So for both of those, we are significantly below where we would expect. It's not enough just to look at mortality rates. It's really important that you look at them in context. So we also look at how long our patients stay in hospital, and we also look at the risk of patients coming back into hospital. Because, for example, if you discharged a patient too soon, then there might be an increased risk of them coming back. Again, if you look at the two lower graphs, we are significantly below where you would expect us to see as an organisation, and that's really good news. It means that our patients are spending less time in hospital, and it means that when they do go home, there is less chance of them needing to come back to hospital. Can I go on to the next slide, please? So I want to talk a little bit about research at East and North Herts. We're really, really proud of the work that we do. So in the last year, more than 3,000 of our patients agreed to be part of a research study. And that's important not just for research, but actually it's important for those patients as well, because we know that any patient that takes part in a research study is going to have, on average, a better outcome than patients who don't take part in a study. I'm also really pleased that we've published 348 research publications. So these are publications that have been written by Trust staff and have then been peer-reviewed and placed in major national and international journals. We've undertaken research in 15 of our specialities, and research is really important for the finances of the Trust as well, because it brings money in. As you can see from the graph below, we are the top recruiting Trust. I think bar one, it says we're right at the top. I think there's one above us, but I need to check that graph. But we're doing really, really well in terms of that. And I thought I'd just talk very briefly about three of the trials that we've been involved in the last year. The first trial's got lots of abbreviations and initials, but it's a new drug that we are using in melanoma, which is a particularly difficult to treat skin cancer. And this particular drug causes the body's own T cells to attack the cancer cells. So it's a whole new way of treating this particular cancer, and it's one that's yielding really interesting effects and very, very positive. So I'm really excited that we're involved in that. The second one is a trial looking at new ways of measuring prostate cancer. Many of you will know that PSA is used to measure prostate cancer, and it's a useful test, but it doesn't always pick up cancers. And sometimes it's really hard to tell what's happening with the PSA rate because it's not very specific. So we're looking at other things we could measure in prostate cancer. And again, we're getting some really, really interesting results. The final one is a way of dealing with damage to the coronary artery vessels. And it's looking at different drugs that we could use. The reason why I've put in three such different trials is just to show you the breadth of the work that we're doing and the importance for the patients that we see on a day-to-day basis. Next slide, please. I also want to talk a little bit about the green plan within the organisation. It's really, really important to us. We know that the changes that the climate changes are bringing along will harm our patients, and therefore as an organisation we need to make sure that we are minimising that harm wherever we can. we've achieved an awful lot through the Green Plan over the last 3 years. There's a particular gas that we used to use in anaesthetics called desflurane. It has a really, really high greenhouse gas impact, sits around in the environment for thousands and thousands of years. We've been able to stop using that, and we've shifted to gases that cause much less harm, although in many cases we're not using gases at all, we're using intravenous anaesthetics. We've also turned off something called our nitrous oxide manifolds. That doesn't sound very exciting, but nitrous oxide, again, is a gas that really damages the environment. By not using manifolds, we decrease the amount that escapes into the environment by 98%. And as you can see from that list, there are a number of other things. Anita's already mentioned that we are changing many of our lights in the organisation to LED. That decreases the electricity usage, but we're also generating much of the electricity that we need from the solar panels that we've got. Next slide, please. We've refreshed the Trust Green Plan in the last year, and we found 11 key areas that we want to focus on over the next few years, and I've listed them there. A number of members of staff are involved in the green work that we're doing, and please, if you're watching this as a member of staff and you'd like to get involved, please make contact. Thank you.
Thank you, Teresa. Thank you, Justin. I'll hand over to Martin Armstrong, Chief Financial Officer.
Hello, everyone. Yes, I'm Martin Armstrong, Chief Finance Officer. And obviously, we've had some unpredictable and blustery weather today. And I think as I was walking, I was blown over here. I was thinking to myself, Martin, isn't it true that the finance section of an AGM is a little bit like a weather forecast? And I think it is true. Mostly cloudy, the odd bright spell, and an occasional downpour. Please do stay with me. I'm going somewhere with this, because actually, the British weather, NHS finance is something everyone moans about and grumbles about, but actually we can't stop talking about it either. So today I'm going to give you the finance readout, the storms that we've weathered, the clear skies we've glimpsed, and what the forecast for the year ahead kind of looks like. You'll be relieved to know that that's the tortuous introduction kind of out of the way, and we can concentrate on some real facts now. So I think, Chris, if you wouldn't mind going to the next slide. Always worthwhile talking a little bit about the overall financial framework that we've operated as within as a trust kind of this year. By and large, it stayed relatively kind of stable. We continue to gain the vast majority of our income through fixed and block agreements with our commissioners, but we do have earned a significant share of funding through delivering extra and additional elective work this year as we try to reduce waiting lists and waiting kind of times. Savings requirements, of course, remain a really significant ask for all NHS providers, and that's no different at East and North Herts. And you see the scale of what we targeted for the 24-25 year, with a much greater emphasis kind of nationally being placed on productivity improvement. If we look at the next slide, kind of, Chris, is a traditional kind of ECG chart of the Trust's kind of financial kind of health, looking back over the last kind of decade or so. And you can see the kind of massive cardiac arrest that we kind of had back in 2016, kind of 17. But actually, you can see from that kind of point, actually our finances have remained much more stable over recent years. And that's good news. Because actually that good news, if we move on to the next slide, has also allowed us to do some really important and impressive things, I think, in terms of investing in our capital and our infrastructure as a trust. And I always like this infographic on there, because we've spent almost kind of £30 million kind of last year across a number of kind of different kind of headings. You can see IT, strategic investment, our renal kind of modular unit as a particular investment last year. We're also spending a lot in terms of keeping the show on the road in terms of backlog maintenance around our various bits of our infrastructure, and still a large amount in terms of kind of capital medical equipment as well. We have a number of kind of statutory duties that we need to kind of achieve as a trust, and if we move on to the next slide, kind of, Chris, we can see the headline messages there. We did deliver a small kind of surplus, £1.5 million kind of last year. We've stayed within our capital allocation, delivered our rate of return, and slightly kind of short in terms of our better payment practice code. That's our commitment to pay suppliers within kind of 30 days. So working hard to make sure that we hit that in the year ahead. I think it is, moving on to the next slide, just worth just delving a little bit more into some of the headlines of some of our revenue kind of performance. As I say, we delivered a small surplus for the year ahead, for last year, but that was really important in terms of helping our local system to break even as an overall kind of entity on there. We set an ambitious target of £33.6 million worth of savings. By and large, we delivered that. But we needed to acknowledge that actually some of the ways that we did that, in terms of reliant on non-recurrent in-year means of doing that, isn't what we intended to at the start of the year. And that's a challenge for us kind of going forward. In terms of our kind of financial kind of performance, you don't just have to rely on kind of my view that we did quite well next year. If we move on to the next slide, we can see that our auditors have had a look at our accounts. That's BDO, and they're independently kind of appointed, and they spend a good couple of months kind of looking at our accounts, pulling them apart, establishing that they are a true and fair view of the organisation's kind of financial performance. And that is indeed what they've been able to kind of report. They do also deliver a value for money kind of assessment of the organisation in there. And look, they've called out some important things that we need to work on, particularly in relation to our savings delivery and the sustainability of how we do that. And we're taking some of those recommendations and learnings into the year ahead. So that final bit, returning to the tortuous analogy of the weather forecast, what does it look like in the outlook for 25-26? And if we move on to the final slide, look, the challenge of savings that all NHS providers are going to need to deliver this year is really, really significant at an incredibly high level, and that's what we're going to need to focus on there. It is a really tight financial kind of climate, perhaps a tighter funding settlement that we've seen in recent kind of history, and again that greater scrutiny, that greater emphasis around kind of productivity. And of course we need to achieve all of these things in our finances within the context of kind of operational kind of pressures, and they are significant around kind of urgent and emergency care, and also continue to make inroads into waiting lists. And we need to do it, of course, maintaining all of the quality improvements and high standards that Justin and Teresa have kind of set out kind of for us. So 25-26, I probably say this every year, it's going to be a difficult year, but I am sure that we'll rise to that challenge. So I'll probably stop there.
Brilliant, thank you, Martin. Now, finally, I hand over to our Chief Executive, Adam Saul-Jones.
Thank you, Anita. As you've heard, Adam Saul-Jones, the Chief Executive of the Trust, approaching my 4th anniversary shortly. I want to go to our first slide if I can and just remind people of our vision that we revisited about 3 years ago with a real focus on aligning our efforts to achieve this ambition. And there are 3 bits I want to briefly draw out about being trusted, the consistency of our outstanding care, and exemplary service. And the trust matters to us because as we're addressing our community in this AGM, we want the local community to trust the services. Very few people want to come into hospital, but we want that feeling that if people come in, we know that they can trust the organisation, the staff, the services to deliver what they need. We know every single day outstanding care is delivered, and I regularly get letters from patients just asking me to pass on thanks to the staff where they got excellent care. But I also receive the complaint letters and respond to those complaints because we don't always get it right. And so our ambition is to make sure where we don't get it right, we learn, we improve to the point that we follow standard processes as much as possible so that everyone is entitled to that outstanding care. And importantly, we know so much of what we do is not just about the clinical input from our medical staff, our nursing staff, our other clinical teams, but it's about that broader service. It's about how easy it is to get through on the telephone, how well the letters you receive explain what we're doing, how slick our services are, and how kind and compassionate our people are when you come into the organisation. So this is where we're striving to get to. And then the next slide sets out the 4 areas that we really have put our focus into over this kind of decade to try and continue to improve. The first is about quality, and not just about the high quality, but making sure all parts of our community, with all the inequalities that might exist based on different demographics, on different staff groups, different ages, etc., that we make sure we're really monitoring those inequalities so that everyone gets that high quality care. We know that the biggest asset any healthcare organisation has is its people, and we want our people to thrive while they work for us. And we also know that so many people experience the NHS not as one entity, but they can fall through the gaps when they move from our primary care colleagues with GPs, community teams, into the hospital, back out again. So we really want to focus to make sure that everything is joined up so that users of our service see the NHS as one entity. And finally, we know that we may not be hitting the standards that we would aspire to immediately, but adopting the principle that every day we can make tomorrow better than today. And so really trying to underpin what we do with that aim to not just deliver to services today, but get better by tomorrow. On the next slide, you'll see that we set out every year some particular priorities that under those objectives. And you'll be able to see them on the screen, so I won't read them out, but each year we revisit these through the organisation. And when we set a high level objective, such as number one, minimising waits by redesigning pathways and processes, we ask all of our clinical divisions and all of our corporate directorates to work through and understand how they can contribute and set their own local targets. And that filters all the way through so that each of us in the executive team will be able to point to our annual objectives as an individual will align to these. And we believe that if all of our staff, almost 7,000 staff, are working on these areas, we will see significant improvement. So that's the what of what we're doing. But the next slide really just picks up on the how. And these values have already been mentioned, but they really matter to us. We want to make sure all of our staff who work here feel included, feel they can bring their whole selves to work, won't be judged, but will be welcome and can do their best work. But it's also really important that our patients also feel that they will be treated well, equally, not judged, whatever they present with and how they present. The second bit about respect is that civility and kindness that we would want to treat each other with, but also increasingly really trying to understand the needs of our patients and their loved ones and respecting their life situation, which could be around their employment and how easy is it to get into our services. So that respect goes beyond just the being nice to each other. And as I've said, we're driven by improvement. We want everyone improving their own bit of the organisation because we know when we add it together, we see real change. So I'm going to move just onto the road ahead and just to talk about some of the areas we are focusing on this year that we're already halfway through. So the next slide talks a bit about our physical environment. So many of you will have heard through our news output that we've just agreed a new front entrance to the Lister Hospital. This week the Lister Hospital is 53 years old, and in some areas it shows that. And we're very conscious that some of the offerings for staff and patients and visitors is not in line with others. So we've entered into agreement with a commercial company who are building a new front of the hospital. It's entirely funded by the facilities that are in there, rather than any public money or any trust money going into that, but we think it will create a really great new entrance to our hospital. We're going to continue to invest in sustainability, and we've already heard some of the things from Justin that we're really looking to reduce our carbon footprint, but we also know there's financial benefits through some of that sustainability work as well. We've touched on our renal services, refurbishing our existing dialysis facilities and expanding our home dialysis investment so that we can train more people to manage their own dialysis in the comfort of their own home rather than coming into centres. We're very proud of our Mount Vernon facility, but that could only dream of being just over 50 years old. It's much, much older than that. And old buildings require that kind of investment. We've put significant effort and investment in this year, and we continue to do that to make it a high quality healthcare facility. Some of you may have even had the pleasure of staying here at the Lister, and will know in our main tower block, the outside of the building really needs some refreshing now. And so we've had funding for a scheme to refurbish the outside of the tower block, including new windows throughout, which will make it a more pleasant environment for those staying in, as well as meeting all of our safety standards. And the last point there, fire safety remains really important when we have such a large and busy building, and we need to make sure we're constantly staying and refreshing in light of that. But the next slide talks about the digital world, which we seem to be entering more and more in every conversation. And a big development for us is a new electronic patient record. We are still very paper-based in this organisation and also have multiple digital systems. And over the next year, we will be implementing a new integrated electronic patient record that brings our systems together, will allow us to enable more and more digital access for our staff and our patients. And that's going to be an exciting change that we believe will release significant time for our clinical staff so they can spend as much time on caring as possible. But we also know that the interface with our patients has got to be more digitised. The days when we send letters out for every patient are reducing. Those that need letters will still get them, but as we've heard already, our patient hub, we've already got half of our specialties on there, but we'll be giving more and more control to our patients to receive all their correspondence, and we want to move to a position where people can book and change their own appointments through that patient hub. And it seems that a day can't go by at the moment without talking about artificial intelligence. We are already using it to support what we do in our diagnostic capability, to support our clinicians reviewing scans. We're looking to see how we can use it in our administration functions to release people's time to do things that they had to do manually. And I'm sure as society moves on that, we will continue to do more and more on that. On the next slide, I just want to touch on our improvement system. We remain working in partnership with the Virginia Mason Institute from Seattle. And we're now a couple of years into that work in the E&H production system, as we call it. And it's really about empowering and training our staff to be able to make those improvements in their own area, changing the way we lead in the organisation, recognising that our frontline staff are the experts in what they do and really giving them their opportunities to improve. We've seen already a number of areas where we've managed to deliver significant benefits, and we're just entering a busy phase now with over 1,000 of our staff trained in the methods, that we've got activity happening over October and November all across the organisation. So a really important time for us, and actually gaining lots of interest from across the country and even back in the States where the work's come from, who are wanting to talk to us about how we're doing this work. So the final slide I have is really talking about the future. People will be aware that the government and NHS England have recently launched the 10-year health plan with 3 big shifts. And those shifts are about moving more services away from the hospital setting into community, nearer to patients. Becoming more digital in our actions so that we put more power in the hands of our patients and allow them to engage with their own health and services digitally. And really trying to prevent people coming into sickness by living better, healthier lives. And we will play our part in developing the response to that 10-year plan. This year we've been asked to take on the leadership through a host provider arrangement of all the care across East and North Hertfordshire. So that's the hospital services, the community and primary care. And it's really great working with our partners to coordinate that work so we can better meet the needs of our population with an ambition to not just treat people quicker, but improve the health of our population. And as already been mentioned, I think we've been waiting for a while now for the opening of a medical school in Hertfordshire. And we're delighted that that's progressing so well. And we really look forward to playing our part in hosting many of those medical students here in East and North Herts teaching NHS Trust. And at that point, I'll hand back Anita.
Thank you, Adam. So thank you to the executives that you've heard from so far, Teresa Murphy, Justin Daniels, Martin Armstrong and Adam Saul-Jones. I'd like, now that's the end of our sort of formal presentations for you, but we'd very much like to hear from you and what you have to say on your questions. So I'm actually going to hand over to Ailey, who can tell us if we've had any questions in.
Hi, so we did have 2 questions in ahead of the AGM, and we do have some people online, so if you can see the live chat, please do put your questions in there and I can ask them to the panel. So I'm Ailey, I'm the Director of Communications here at the Trust. The first question that we had in was around Martha's Rule. So it was that the Trust has been piloting Martha's Rule for some time. How has this worked in practice, particularly for kidney patients, and what lessons have been learned?
Thank you, Ailey.
Thank you, that's a great question. So we have indeed implemented a team that supports Martha's role, both in the adult side of things and also for children. We've seen over 100 calls so far come through, very experienced team of senior nurses working back to back with our medical colleagues. And we haven't specifically had any calls from our renal boards, but we do in that team have some very experienced nurses who've got renal experience should they require any support. Of the 100 calls that we've had so far, approximately 5 have gone on to much more complex interventions, and we've had terrific feedback from all of the patients and their families so far. I don't know, Justin, if you'd want to add?
No, I just think it's vitally important that we've done this both for adults and children. Many people watching will know that Martha was a child, and I was adamant that when we launched this, it would be for all ages within our population.
Thank you both. Amy.
Thank you. There was mention of us being in segment 2 as a trust. So there was a question ahead of the AGM about why do the NHS league tables matter?
Yeah, it's a really good question. Adam, I don't know if you'd like to comment.
Yeah, thank you. So I think what's behind this is the government's drive has been about increasing the transparency of how hospitals are performing. Not necessarily so much for patients to decide which one they want to go to, but a sense for local communities to understand how their local services are should they need them. Not just on the quality actually, but how well they're run financially. So there is an assessment, but also that the NHS England can then target their support. So looking to the highest performing organisations to see where those organisations can help others, but really targeting their support in those that are struggling. Often struggling not for necessarily reasons within the control of the hospital, but it could be a very rural hospital that might find it difficult to recruit staff, might have different challenges to someone in central London. But it's really about exposing that in a way that we can be very open with the public about the areas we need to improve, but also that ability to celebrate for staff when the results are clear on the good work that they know where they can build on rather than not necessarily be clear on it. So that's really the drive behind the league tables.
Great, thank you, Adam. Amy, do we have any other questions?
Yeah, we've got a question from a viewer who's asking, with the Virginia Mason work, so the ENH production system, how are we incorporating patient, resident and staff opinions of improvements that need to be made, and particularly with shaping objectives?
I don't know. I wonder if I could ask Kevin O'Hart, I'll let him explain, introduce himself. But Kevin.
Thank you, Anita. Good evening, everyone. My name's Kevin O'Hart. I'm the Chief Guidance Officer at the Trust. Thank you for the question. I always like the opportunity to be able to talk about anything and all things to do with the Eastern North Arts production system. So, a key part of the standard work for all of our improvement events that we've been running over the last sort of 18 months very much builds upon the essence of co-production and ensuring that very much the voice of our patients are involved in those processes. And there's been some really good stories and examples of that from work that we've done in the last 12 months with both our ophthalmology and our paediatric teams, which has involved sort of focus sessions and surveys and questionnaires and observational work that's very much either been talking to patients and carers out in the Gembas during some of that improvement work, or indeed during the improvement events, talking to those people about what we're intending to do, listening to their experiences, their lived experiences, their ideas for what they'd like to see change, and then teams bringing that back as part of the improvement work that we take forward. In terms of how we involve staff with shaping what the improvements look like, the very sort of philosophy of what we're trying to do here is that improvement is led by those that do the work where the work is done. So through a variety of sort of training offers, we're encouraging our leaders to become sort of leaders as framers and creating an environment out in the clinical and non-clinical areas in the organisation so that they actually invite staff to come forward with their ideas for improvement, but most importantly, again, the staff themselves are those people that are able to move forward with those ideas within their local environment. And it's really about small, daily, incremental tests of change and improvement so that we just get incremental improvement going as part of just the way that things are done around here. I think then the third element of your question is really just about how that helps shape trust objectives. And we have kind of moved, as Adam talked about in his update, towards these kind of more broad, multi-year strategic goals and trying to give more of a hook to teams and departments everywhere. So no matter where you work or what staff group you represent or what level of the organisation you are at, you can understand what your role is as one of 7,500 people and to shape those that direction of travel. And what we're trying to do is generate a process where we kind of play catchball, as we call it, with teams, and we talk to them about what our thoughts are around those strategic goals and what they should look like. And we encourage feedback from teams back to us about what that feels like to them and what that kind of looks like. And then that kind of cascade process goes down across the organisation into individual teams and departments. And I think I'll just pause there.
Brilliant, thank you, Kevin. Any more questions, Amy?
There are no further questions there.
Brilliant. Well, thank you. And thank you to everyone who has joined us online. I hope you found this interesting and valuable. If you do want to get involved, either as a member of the Trust, please go onto our website and look at the link about becoming a member. If you'd like to help to support the charity, again, all the details are on there. Or if there's any piece of information that you aren't able to find easily, please contact our communications team, and I'm sure they'll be able to signpost you to the right place. As I said at the beginning, thank you again to everyone that helps us do what we are trying to do. It matters incredibly to us, and we know that we couldn't do it without you. So thank you to all of you. Enjoy the rest of your evening. Thank you. Goodbye.